Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Tell me what's going on with your back, what's happened?
I've had several injuries and I've had fusion in my L.
L5S1?
Yes.
When did you have that?
10 years ago.
10 years ago. And after the fusion, how do you feel? Give me an update, like symptoms.
Before the fusion, I was having difficulty dressing myself, walking, and after the fusion, of course, after a period of time, it got better.
Okay.
But I still had a lot of pain in this right leg from, because I had kind of like a drop foot previous.
Before the fusion, you had drop foot. After the fusion,
it just was constant. It's not dropped anymore, it's just constant pain.
Constant pain. How much do you rate your pain from 0 to 10? 10 is emergency room.
I usually run, a normal is about 7.
7. And where do you feel the 7 out of 10?
In my lower back and down my leg.
Your lower back? Okay. And is it going down in the back, the front, where it's
the back?
The back. Okay. So what's difficult for you to do to cause this pain?
Driving.
Driving?
Sitting.
Okay. So that's aggravate your symptoms?
Yes.
Can you give me a brief of what kind of treatment you had in the last 10 years for your back?
I've had the fusion, I had a laminectomy after the fusion.
Laminectomy, so 2 surgeries, okay.
Yes, and when they did the laminectomy, they nipped my spinal cord.
Oh, okay.
And then after that, I had a stimulator put in.
Okay.
And then I've had
Do you still have it or do you remove it?
No, I had it removed.
Okay, so, okay.
And then I've had ablation, many shots.
Okay.
Physical therapy.
Yeah, physical therapy.
Water therapy.
Okay.
My physical therapy book is
good. Okay. So any other treatment, chiropractor or massage?
I do a lot of massage.
You do a lot of massage?
Yes.
Okay. All right, so so basically you did everything in the book. So any other symptoms I need to know about?
I have neuropathy and Morton's rheuma in my right foot and neuropathy in both feet.
Both feet, and you start from the ankle down?
Correct.
Okay. So we're gonna do the motion aggravate. So your pain constant or just ups and downs?
It's constant. It does get worse depending on what I've done, but it's pretty constant.
Constant how much from 0 to 10?
Constant, it runs anywhere from a 5 to a 7 to a 10.
And show me where is it exactly? Is it like especially back there or
it's in these, I have muscle spasms
in this area?
in both of these areas. I have a lot of scar tissue on this side.
Because you had the stimulator here?
Correct.
Okay.
And then it just looks like a checkerboard back there after the surgeries.
Okay. And what about the pain going down to your hamstring?
It just runs right down here, and it just feels like a burning pain all the time right here.
And is that, so this is a constant pain, but this is increased with sitting, the hamstring? And sitting or standing or just sitting?
More sitting.
More sitting.
Yeah.
So you have 2 different issues here.
Yeah.
Okay. So
driving really aggravates this one.
So if we wanna aggravate your symptoms now, what we can do?
Well, I drove here, so this is nice and hot for you.
So the spasm there.
These are already spazzing, so they've all been aggravated.
So
and bending over would probably be.
So let's do the range of motion, and I want you to give me a number for each range of motion, how much pain is that. Let's bend down. Okay, marking your legs, how far you can go down, marking your legs. Okay. So it's above the knee here, above the ankle.
This is much more comfortable.
Where?
Like up here.
Up here, there?
Yeah.
So it's more comfortable a little bit lower than the knee. Okay, so we need to remember this. Okay, go backward, extend. How is that? Oh, you're really tight. Well, you have fusion. Okay. So you tell me if whatever is aggravated from number from 0 to 10. And twist to the left and right. You're getting the whole body. Okay. and side bend left and right. So the worst motion is bending down.
Yeah.
That's the worst motion. And how
Yes.
much pain from you to tell me that?
I have if I have to bend over for any length of time, like I have cats and I do the cat box, that is just
Okay.
not a good thing.
Alright. So I will have you lie on your side. So which side is the worst?
My right side.
Your right side. Okay, so let's lie on your left side. And I'll have you lie right here. So I'm gonna work on your back, okay? Just bend your knees.
That's how I sleep. A little between my knees.
Yeah, you can take a nap, but
Okay.
don't snore, okay?
Well, you're out of luck then.
Alright, okay. We're gonna mute. Alright. So make sure whatever I'm doing is not painful, okay?
Yes.
Okay, I'm gonna get a gown. Excuse me. Okay. Okay, so this is the fusion was okay. So you have a scar here. That's a stimulator here.
The stimulator is down, is this way.
Oh, this one.
Yes.
What about this?
I've had fusion and then
Fusion is here. Okay. So there's 1, 2, 3, 4.
Yeah. And when they did the fusion, they cut me open from hip to hip, and then they flipped me over and cut me open because they put cadaver bone in. I think I was in surgery for like 7 hours.
Yeah. So they cut the front too.
Yes.
Okay. Man, you had all the surgery that they usually do for everybody.
Yep.
Man. Okay. Was the same surgeon or different?
It was the same surgeon.
Okay.
And between the fusion and the laminectomy, because usually they do the laminectomy first and then the
Okay.
fusion,
Yeah.
but I had it done backwards.
Why?
I don't know.
Okay.
I think he did the laminectomy afterwards because I was having so much pain in my leg.
Yeah, afterward, because if he did not have symptoms, he probably will not do the laminectomy.
So,
Yeah.
like within 6 months of having the fusion,
Yeah.
I had a laminectomy.
I'm sorry you had all the surgeries.
Yeah, me too.
Yeah. Well, the good news. Sorry, is it painful?
Yeah.
Okay. Make sure it's not. Your fascia is really tight here.
Yes.
Do you feel pain here, or it's
Yes.
okay? Make sure what I'm doing is not aggravating. Okay.
Okay.
And you're really tight. So can you give me a little brief history of your medical history? Had any other surgeries or any?
I've had many
Mhm.
tonsils, breast,
Okay.
carpal tunnel, knee,
Mhm.
elbow.
Mhm.
I don't know what else I've had.
Yeah. Abdominal surgery.
Oh, I had laparoscopy.
Okay.
That's,
Do you have a lot of scar tissue in the stomach area?
Probably, yeah.
Okay.
That's-
So you said you have pain even here too?
Yes.
Okay. Can you tell
Right
me a little
shoulder.
bit about this too? It's on this side or
It's
the
on
other
the-
side?
It's on the left side.
Left
Yeah.
side here. And that tender here?
Yes.
Sorry. Okay. So you have you feel that scar tissue here? So this has been going on for the last 10 years, you said?
Probably longer. I mean, initially my back problem started when I was about 12.
Okay.
I broke my tailbone, and then it just continued from there. They
Okay.
said some of it was it was just congenital. It was like bad.
Mhm. How does it feel what I'm doing here?
It feels okay.
Okay. Make sure it's not painful.
That's just really tender down there, but you're okay right
You
now.
feel the tightness here?
Yes.
Okay. Did anyone work on your scar tissue?
I have had it worked on.
What did they do?
I've had massage done, and then kind of like your tools, but what is the?
The metal? Grafton?
Yes, where they scrape it and they bruise you and they hurt you.
Well, that sounds optimistic. Yeah.
That's painful.
Well, if they bruise you, that's mean it's causing more inflammation. Which, when you cause more inflammation, that's gonna cause more scar tissue. So
It wasn't fun.
I disagree with that philosophy. How do you break a scar tissue and causing a new scar tissue?
Not right.
How does treatment? Unfortunately, it's a bad methodology. So what else? So you had Grafton, you had massage.
Shots.
What?
I don't think the shots did anything for the scar tissue. Just massage mostly.
Well, what kind of shots?
Just the steroid and cortisone
Yeah.
and all that.
Is it too much what I'm doing?
Yeah, a
Sorry.
little bit.
You feel that scar tissue here? Okay. So
I know I have a ton of it.
yeah. Here too. And
I told you it was like checkerboard back there.
yeah. Make sure it's not too much here, okay?
Okay, it's getting up to
Sorry. Okay, so you have inflammation there. Okay. Is it too much or it's okay?
It's okay.
Okay, I'm gonna do this area too. Sorry, I get some like lotion all over the place.
It's okay. I'll wash this off.
Yeah. Did anyone work on your stomach?
When I did the therapy for the interstitial cystitis, they would.
The what?
For the, I have like spasms in my bladder, so they would work
Oh,
on
okay.
my stomach.
Okay.
And then I started asking my massage therapist to work on my stomach.
Okay.
But they won't do your stomach unless you ask them.
Okay.
They'll just do your back. or
We're gonna
your-
do the stomach today. Are you comfortable with that? Yeah.
Yeah.
Okay. You definitely have a lot of scar tissue. You can see like your
Yeah.
back. It's not only the area you had the surgery.
Mhm.
It's the entire back.
In my stomach, there's a tight spot on the left side always.
Okay. Where?
In my stomach area. It's in the left side that they always have problems.
Okay.
It's okay for it comes early or 10:30 is fine.
It's fine.
She comes early
10:30.
and then
Are you guys open on Saturday?
No. I see patient. 4 days a week now, like sometimes 3 days a week. That's my schedule, but
Okay.
I have someone else
Friday.
is working 5 days a week. So, yeah, but you can see a lot of scar. You guys want to watch this?
Sure.
You see how much scar she has? Look, the entire back. You see all this redness?
Mm-hmm.
That's all scar tissue here. You know? And here. See, it's actually... And when you see more redness, that's an indication of the thickness of the scar. And look here. It's going up. It's not like a smooth. It's just going upward like this. That's a very thick one here. And here, look at this. You see? So when she's... Because you're complaining of a lot of back spasm, I'm not surprised. Because the muscle should act like a rubber band. So her muscle should be stretchy like this in the back. but because she has a scar tissue, her muscle cannot stretch much. And she starts to have muscle spasm here, and she has a fusion. So she's gonna compensate here, and that will stress her surgery. So that's why we need to really get rid of those.
She was
But yeah,
thrown from a horse and hit a fence. with a
really, how
No.
like what did she hit?
I thought it was her back.
Didn't you hit your leg or your back with the fence?
Both.
Both?
Wow.
And,
I have a lot of back.
and then
Stories
instead
with
of taking
horses.
care of that, she walked all over Jordan
Oh wow. Yeah.
And Amsterdam and Egypt.
Where?
Egypt.
Oh
And
man,
overseas.
that's not fun.
I was on crutches.
Oh my gosh.
And her leg was black all the way to her hip, too.
Oh man.
And she wonders why. I don't know why that hurt. Why?
Okay.
I should talk.
We're telling them.
I should talk, huh?
Okay, so let me clean this up. But you guys see that. It should disappear in like 5-10 minutes. But you can see the map. If you come this side, you will see the map.
So
of
what do
the
you do
scar
for
tissue.
that?
I'll just break it down. And because it's very thick, so we need a few sessions to work on it to totally break it. And I will, and you can see the map, like most of the scar tissue here and here and here, and that's what she complained, the spasm here.
Yeah.
And there's a scar tissue here that's harder here.
Yeah.
Okay, so let's lie in your back. Is that okay?
Yeah.
Are you comfortable lying in your back?
Yep.
That's okay.
What, underneath your legs?
Yes.
Put this underneath the legs. Is it okay to work on the stomach? Okay. Is it okay to work on the skin?
Yeah.
Okay.
You'll feel it though. It's right in here.
That's the surgery here.
I just have a laparoscopy, so,
Okay, so
but wherever it's super tight.
sorry, they cleaned the outside. It's a little bit noisy. Is that painful here? That's a scar tissue here. Okay. And you have a lot of tightness
Am I
here.
wrapping your waist?
No, no, you were fine.
So I'm gonna do some organ release. I'm not sure if someone did that. Or massage, they're not gonna do that. So I'm gonna release the tightness that you have here. And you have a scar tissue here, okay? Do you have digestion issue?
Yes.
Okay, so you tell me next time if you feel better with digestion after this. Okay? Because when you have a scar tissue and a lot of tightness, think about your GI system like a balloon. When you have tightness, that balloon is compressed.
Okay.
So sometimes actually the flow decrease, you know.
I've tried to change my diet because I was just getting tired of it.
Yeah, we'll go over diet after that. I'm just gonna do the nutrition evaluation and see how's your current diet, and based on that we'll figure out what we can do to help you with that. Yeah. You feel the tightness here? Okay. So more like where is your abdominal issue? Where do you feel pain?
In my bladder area down low.
Down or there? Okay. Okay.
It burns.
So for how long this been going on? The bladder?
I had a hysterectomy.
Oh, so you had a hysterectomy.
Yeah. But the Da Vinci, the Da Vinci one, the vaginal.
Okay. Yeah. It's better there about. Feel this one?
You'll find a really tight,
Yeah.
like, band almost.
So again, make sure it's not painful, okay? You feel that? That's a scar tissue. It's like a little lump in the middle. Just here. Too much?
No, you're fine.
Yeah. Okay. They really want to clean this out.
I know.
very determined.
Well, yeah. And they get it all right in here next to us. Good timing, buddy.
Oh, that's super tight.
So,
That was sore.
okay, and you can see the scar tissue here. Do you have breathing issue?
Just recently, in the last year.
Yeah, you can see here, like closer to her diaphragm. You see most of the scar tissue here. And here.
That's where all my scar tissue is.
You can feel it.
Yeah.
Because I've had appendix, gallbladder,
Uh-huh.
and then lipoma.
Okay. So I want to know, like, how do you feel breathing wise when you stand up after doing this?
Okay.
Okay. And how's your back feel? Feel that?
Well, I can already feel, yeah,
What do you feel?
because to lay here like this would be
Mm-hmm.
not a good idea.
Okay.
And-
What about
and
now?
it's much more relaxed.
More relaxed?
Yeah.
Okay.
This would kill me to lay flat like this.
But you're okay now?
Yeah.
Uh,
Got two big suitcases going deep in.
yeah. You really bring it here. Okay, so let's stand up.
Okay.
Can you get some water for her, please? And we'll have you stand up here. And I want to know the constant pain, how much from 0 to 10. How's your back feel? How's your stomach feel?
It's so different.
It's,
You can feel it in my, I wish you would have felt my back before we started. It
yeah,
was like a rock.
yeah, it's,
Now it's squishy. Feel. You can feel
well,
my
the soft tissue,
back.
the tissue should be feeling soft, pliable.
Yeah.
Yeah.
It's like night and day.
Wonderful.
Thank you very much.
That's a good description. Yeah,
Mhm.
when you have intense scar tissue, it feels like a rock.
Yes.
When you start to break it down, it
It's
softens
so
out.
much different.
And usually what I expect is the size start to shrink and the thickness start to decrease.
That's
So
wonderful.
the bump will not be like so bumpy, like a little bit flatter.
And there's nothing she could do at home to decrease
I'm
that?
gonna go over what to do. The prevention is better than treatment, so because she will not be able to break the scar tissue, she has to have tools.
Right.
But we will go over what to do not to build a new scar tissue. So when we break it here, there's no reason to build a new.
Gotcha.
Oh, you come on this side. Alright, you just follow us, say it like us. Alright, so let's tell me how much the constant pain, how you feel now?
It's gone down.
0
Oh.
to 10? Let's drink some water.
Mm. Compared to when you started,
Yeah,
I'm below a 5.
okay.
Yeah.
Where do you feel it now? And
I
how
still
much
have
is
a
it?
little bit right here, but nothing like when you started.
How much from 0 to 10?
It's just a small irritant now.
0 to 10?
We'll say a 4 or 5.
So in that spot exactly.
Yeah,
what about
not on
the,
this
the
spot.
triangle shape that you were describing, the muscle spasm? Let's bend
No.
forward. We'll put this here. And I want you to bend forward because you were saying this
This
is
was comfortable.
Let's see how you feel now.
It's just tight.
I did
here
not
now.
work on the hamstring.
Yeah, I
I'm gonna
know.
work on that. Okay.
But no, I don't feel it pulling in my back.
So that
No.
original pulling you don't feel.
Yeah.
Okay, so we're gonna work on the hamstring. And where is the spot? Right in here.
Yeah. You'll feel it right there.
Right, in just this spot. Okay.
Yeah.
So let's lie in the same position, facing this way. Lying on the side.
On my left side again?
Yes. Okay. So the hamstring, the tightness in both or one side?
Both.
Both of your hamstrings. Okay.
But my right side is always worse.
Your right side. Okay.
Of
So
my hamstring.
you can have this phone. So the right is worse. Oh wow. Huh. That's a big scar tissue here. That's, How
It's
did you
just
do this?
Burning. I have no idea.
Okay, so let me get there. Okay, so this is the spot, yeah?
Down.
Where? Here?
Right.
Here.
Right in here.
Yep. Feel it?
Yes. Let me know if it's too much, okay?
So far, so good.
Okay, make sure you breathe, okay? We kind of want you to breathe here. Okay. I'll give you a needle. Just breathe. Not really, okay? Is that too much or it's okay?
No, it's good.
Okay. Okay, let's get to this. So it's right in here where you feel it.
Yeah.
That's a big one.
Yeah.
You said you strained your hamstring, or what did you do here?
I have no idea. I always thought it was from my back. I really
Okay.
don't know.
Okay.
I've just always had it, so. Yeah, that just burns.
That's too much?
Yeah.
Okay, so here you go. Just release this one. Right here. Too much or it's okay?
That one's better.
Okay.
It still burns, but it just not as bad.
Okay, gonna work on the scar tissue.
Sorry.
It's okay.
I'll stand here.
Yeah, Nicole.
Okay.
Is that too much?
A little bit.
Sorry. Make sure you tell me, okay?
Okay, that is. That's too much.
Sorry, what about now?
Just a little bit lighter.
Okay, what about now?
A little bit
Lighter or
lighter.
less?
Yeah. It's pretty sore.
You have a lot of inflammation here. A lot. What about now?
It's okay. It's still. It's not pain-free. Let's put it that way. But it's not painful.
That is. So what the answer? It's not pain-free and it's not painful.
It's
So
on
how is
the highly uncomfortable side.
okay? Highly recommend it. Okay, let's not do this. Okay, that's a good answer. Okay, so let me actually work on releasing this. So both, so you said this hamstring, this side is worse, yeah?
Yes.
Okay. So let's actually release this.
I put the TENS machine on it all
Sorry.
the time.
Is that too much?
Yeah,
Oof.
it's bad.
You get a lot of inflammation here. Okay.
Uh-huh.
Let me actually do lots of things here. Yeah, TENS is a temporary pain relief, but based
Yeah,
on the
it's
study,
just
it's just one.
Better than taking
True.
medicine.
Yeah.
Yeah, it is sore.
Sorry.
That's okay.
Okay. Wow. Too much here? It's okay.
That one's okay. That one doesn't.
Yeah, I'm not able to do much of work here because you have a lot of inflammation. So I'll go over what to do for inflammation. Okay. Okay, stand up again and tell me how that feels. I'm gonna try to let's get some more water and tell me how is that spot in the back and how is your hamstring?
That's better.
Okay.
I
So
mean, the hamstring's not burning quite as
okay.
bad.
So let's the
Empty the
concept.
tap, no.
What? Oh,
Empty
man.
the tap.
Yeah, we're gonna do that. So yeah, I know because we did not touch the other area. You will be, you have tightness there, so you're gonna want to work on it. We're gonna work on that. But those the back pain and the hamstring. How much from 0 to 10 now?
This is still a good.
I did not work on this. Okay, what about the side I worked on? And
This is the side you work on.
did I work on this?
Yeah.
Oh, okay, this one. Okay. The back 0 to 10
We're at a 4.
in that spot.
Yes.
Okay, what about the hamstring? I have a lot of information. Let me see how far you can go down. Now you can turn around.
Oh. This way?
Okay. How's that?
Oh, it's not as tight.
Yeah. You going
This
down?
one still is, but
Yeah.
this one isn't.
Oh, you're going down more on
Yeah,
that side?
I can touch my ankle.
Oh, on this side. That's beautiful.
But
Not this one. Okay, do me a favor. I want you to have a seat here. Make sure one leg is not too much, okay? You have more inflammation in hamstring than your back. That's why I'm not able to do much work. You're not tolerating the gentle maneuver of the tools. So we need to do work to decrease the inflammation so I can do more work. Okay. But your back is tolerating better than your hamstring.
Yeah, that doesn't hardly hurt as much as it used to.
What?
When you were messing with my ankles.
I'm not messing with you.
Well,
No, we don't mess here. Everything has a purpose.
Purpose?
Everything has a purpose. Sit up nice and tall. Is it too much what I'm doing?
Yeah.
Take a deep breath. Take a deep breath. Relax. Relax. Okay, let's stand up. Okay, then turn around and let's bend forward and see how far you can go down. How's that?
It's still tighter on this side, but you haven't done this one.
On that side,
Yeah.
the hamstring. We're gonna go. Okay. And what about the back now?
It's much better.
Okay.
So much better.
So can you tell the difference after the treatment?
100%.
Yeah. So what the difference?
It's not, it doesn't feel like it's in
The
a
muscle
ball.
spasm?
Yeah,
Yeah.
no muscle spasm at all.
That's beautiful.
None.
Yeah, that's good.
None.
Yeah. So can you tell a difference between ASTR and what you had before? You had kerosene and
100%.
chiropractic.
Yes.
What's the difference?
Well, it wasn't painful.
Okay.
That was a
That's
nice
good.
thing.
Yeah.
And I
Not
saw
trying to
immediate
torture
result.
you.
No,
Yeah.
but I saw
Yeah.
a much more immediate result than
That's beautiful. Yeah. That's
I liked
good.
it.
Yeah. Thank you so much.
Okay.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.